Global infections prevalence. In 2010, an estimated 15 million people died from infections, and the World Health Organization forecasts 13 million deaths attributed to these causes in 2050. Two-thirds of deaths from infection in 2010 were caused by around 20 species, mainly bacteria and viruses. The common types of pathogens involved in infections are bacteria, viruses, fungi, prions, and protozoa. Usually, bacteria are classified on the basis of gram staining into gram-positive bacteria and gram-negative bacteria. Main causative gram-positive bacteria are Streptococcus pneumoniae, Streptococcus pyogenes, and Staphylococcus aureus, whereas main causative gram-negative organisms are Haemophilus influenza, Escherichia coli, Proteus mirabilis, Klebsiella species, and Moraxella catharalis. Common routine infections. Respiratory tract infections. Respiratory tract infections are the major cause of deaths reported from infectious disease in 2010. Common types of RTIs include pharyngitis, tonsillitis, otitis media, bronchitis, and pneumonia. In acute RTIs, 80% of pathogens involved are S. pneumoniae, S. pyogenes, M. catharalis, and H. influenza. Urinary tract infection. In acute UTIs, normally 3 organs get infected. If the infection occurs in kidney, it is called pyelonephritis. Infection in bladder is called cystitis, and infection in urethra is called urethritis. In UTIs, 80 to 95% mostly E. coli is involved as a major pathogen. Another infection is acute skin and soft tissue infection, which is also known as SSTIs. In SSTIs, mainly Staph aureus is involved. And the only weapon against these infections are antibiotic. Main challenges associated with antibiotics are widespread, easy availability, self-medication, and inadequate dosage. This ultimately results in antibacterial resistance. Antibiotic resistance usually develops when bacteria's growth does not stop even with increased level of antibiotics. Main factors involved in drug resistance are lowered penetration of drug, presence of antibiotic inactivating enzyme, presence of protein that promote efflux of the drug. In that case, the ideal therapy of antibiotics should be broad spectrum, bactericidal, high tissue penetration, good bioavailability, better tolerability, less side effects, effective at low MICs, and encourage patients' compliance. And where the brand comes, which meets the ideal therapy, is Celclor, a trustworthy companion. Celclor, with the brand name of Celclor, is a researched brand by Eli Lilly. It is marketed globally with the same brand name Celclor. In Pakistan, AGP is marketing same international research brand Celclor. Celclor, the original brand, which is a seasoned remedy for all seasons. Cefaclor or Celclor is a second-generation cephalosporin with mode of action like penicillins, a beta-lactam antibiotic. By binding with the specific penicillin-binding proteins or PBPs located inside the bacterial cell wall, it inhibits the third and last stage of bacterial cell wall synthesis and causes the lysis of cell wall in the presence of autolytic enzymes. What should be the reason to prescribe Celclor? Broader and balanced coverage. Celclor provides balanced and broader coverage against gram-positive and gram-negative bacteria. Celclor showed 100% coverage against gram-positive, which includes Strep pyogenes, Staph aureus, and Strep pneumoniae, and showed more than 95% coverage against gram-negative bacteria, which includes K. pneumoniae, H. influenza, and M. catharalis. High absorption in GIs. As compared to other antibiotics that include ciprofloxacin, amoxicillin, cefixime, And cephorexime, Ceclor provides 95% absorption in upper GIs. Low side effect profile. As compared to amoxiclav, clarithromycin and cefixime, Ceclor is having very low incidence of diarrheal side effects in children. A cost-effective option. Treatment failure in antibiotic not only increases the pain and suffering of the patient, but it also increases the cost of therapy. As per the study of amoxiclav, cefixime and clarithromycin has higher failure rate, that is 8%, 20% and 21% respectively. High clinical success rate. Ceclor proven to be an ideal therapy in upper respiratory tract infections, and its prominent cure rate is 94% in pharyngotonsillitis, 95% otitis media, 93% acute sinusitis, and 97% acute bronchitis. Best coverage in acute otitis media. Ceclor has 98% proven clinical success response against Streptococcus pneumoniae, H. influenza, and Moraxella catarrhalis. JPMA's clinical study published in September 2000, which is conducted in 13 centers of Pakistan for otitis media, upper respiratory tract infection and lower respiratory tract infection, clearly resulted in 97% in vivo efficacy and 93% in vitro efficacy. That is why we claim that Ceclor is an ideal choice in respiratory tract infections. Ceclor proven efficacy in UTIs. Against UTIs involved pathogen of Klebsiella, E. coli and Staph aureus, Ceclor achieved 600 microgram per ml MIC with a single dose of 250 mg capsules. High cure rate in post-ops. If we compare 1 week post-therapy response of cephorexime with Ceclor, the results show that Ceclor achieved 97% patient's cure rate. Edge of Ceclor over cefixime. With reference to the leaf insert available of cefixime, in post-operative, main pathogen involved is Staph aureus, and as per reference, cefixime is resistant against Staph aureus and all strains of Staph, whereas Ceclor provides 100% coverage against Staph aureus in relation with lowest MICs as compared to cefradine. Cefixime should be discontinued to pregnant and lactating women because it is not recommended to less than 6 months of lactation, as cefixime excreted in breast milk, whereas Ceclor is safer to prescribe in lactation because it is FDA Category B. Better option in SSTIs. In SSTIs, against Staph aureus, Staph pyogenes and Haemophilus species, only Ceclor provides 90% clinical efficacy as compared to amoxicillin. Ceclor is available in children's favorite flavor, strawberry. Ceclor, an ideal choice prescribed by all leading consultants worldwide.